is very much affordable. And if you want to see an example, you have to come here. The reason why, first of all, rural healthcare is not just primary, because their needs are as much as for the people in the urban areas.
Yeah.
So, I mean, they also have diabetes, and they also have heart attacks, and so they also have snake bites, which requires intensive care. So, I mean, the needs are the same. It is just that the kind of facilities that that exist in rural areas are far inferior to those in the urban areas. I mean, whether in terms of availability of doctors, availability of facility, availability of other trained medical professionals, there is a great lag between the urban and the rural areas. The whole basis of establishing this institution was to provide to the rural community the same level of healthcare as is available to those in the urban, to their urban counterparts.
Okay.
And so, I mean, 30 years of its existence, we have tried to see that in terms of technology, in terms of the skilled manpower that exists, in terms of the services that we provide, we match everything that is available in urban areas. That's so far as the availability of healthcare is concerned. As far as affordability is concerned, we believe that it is possible to be affordable if the focus were to be not so much on making profit. And for example, the average cost of treatment in our hospital, if one were to take all kinds of patients together, whether medical, surgical, they are in deluxe rooms or in general wards, if I were to put all of this together, the average cost works out to be in the range of about 5,000. These are hospitalized patients. Average is between 4 and 5 days.
So 1,000 rupees per day.
Something like that.
Okay.
Now, with that, it's not as if we are making surpluses. Okay? We have deficit in the hospital, but a large reason for the deficit is the amount of concessions that we provide. If our income is 100 rupees, 20 rupees of that goes as free treatment. If I were to add back the concession that we provide, we would be making, we would be breaking even. Right? So what that means is that the charges that we have, as reasonable as they are enough to cover all the costs that we incur. So healthcare, traditionally is kind of seen as, an area where the margins are very less, which is actually not really true, because from our own experience, we believe that it is very, very possible to control the direct costs. I think the only cost that one has to worry about in healthcare is the kind of salaries that are provided to the doctors, because that is a very scarce commodity. If you want to retain good doctors, you have to pay them, and we do pay them. So I think if you can keep the direct costs within reasonable limit, and our direct costs are kind of at par with what the industry incurs, which means that you take care of both the purchasing efficiency and take care of consumption efficiency. Whatever that's being purchased is purchased at the least possible price, and that wastages at the consumption level are reduced to the maximum.
Okay.
That's what we try to do, and that's how we kind of maintain very, very lean direct costs. So with that, it is possible to do.